our numbers.
Dr. Hassoun, thanks for joining us again tonight.
Thank you for having me.
First of all, as you know, Governor Kay Ivey extended the mask order through November 8th. Do you think that was the right move with the numbers we're seeing?
Absolutely. I think we're going to need to extend that order till at least February or March.
Wow.
Because we're going to need the masking and the physical distancing. It's essential at the moment because that's what we have currently to reduce the chances of infection and the spread in the community, whether for the COVID or the flu or other viral respiratory infections. So it's very important to extend and continue that.
Dr. Hassoun, the governor mentioned that we've been very fortunate not to see the spike that we expected after Labor Day weekend, but there are still 119 coronavirus inpatients in the Huntsville hospital system. Why do you think that we didn't see a spike like this this particular holiday like we did after, say, the 4th of July or the Memorial Day holiday?
I think part of it probably community-wide there has been more toward using the mask and physical distancing as much as possible. The other part is, are we really not seeing severe infection that get detected versus a mild to moderate? There's several possibilities in addition to the people coming forward to be tested and get checked out. So these three different possibilities is there.
We just mentioned the 119 patients across the Huntsville hospital system, and tonight we know almost 30% of those, about 1 in 3, are in intensive care. Besides obviously being in a worse condition, what are some of the factors with this virus that put people in the ICU?
So in general, those are have what we call multiple risk factors, including immune suppression or simple high blood pressure, heart disease, lung issues. In addition to elderlies, where they're usually more prone to complications, sometimes delay in seeking medical attention or coming to the hospital because they're afraid to come to the hospital, getting mixed and getting exposed. So these are several possible factors get them into severe disease where they need ICU admission or unfortunately intubated and being on the ventilator.
Alabama's ABC board announced bars can now serve alcohol past 11 p.m. In your opinion, is this a recipe for disaster with the threats that bars pose for spreading the coronavirus?
I think it's very concerning they decided that because we've seen it in all other states. Whenever they open it freely, even in other countries, and the best example, for example, the United Kingdom, when they open it up completely, there was increasing cases, and they reversed back and went down to 11 or 10 p.m. where they need to cut down on it. So people need to rethink that process because definitely bars, restaurants is a high risk of transmission and complications.
I want to turn our attention now to schools. We learned West Limestone High School is allowing students to switch to virtual learning after an increase in positive cases there. Now, if a school sees even one positive case, should they completely go virtual for 2 weeks? Or what number of cases do you think is that threshold before they make that switch?
Yeah, I mean, for me, really one case is very alarming because the exposure can be significant. So if there is one case, whether you expose the kids or teachers or anybody surrounding them, there's going to be a chance of 10, 15 get infected. And from 10, 15, that can double up or triple. So I think one case is enough to be on alarm to probably shut the school, clean up, getting ready again, trace, track, test, and know before you really continue doing the same.
In the past week, Fayetteville City Schools announced 2 employees at Ralph Askin School have tested positive for the coronavirus. We know the employees' children were sent home to quarantine. Explain how easily this virus can spread in the classroom and schools.
So, the main way of transmission, as you know, is respiratory droplet, meaning coughing, sneezing, even talking can have some of these viral particle in the air. The main way of transmission is between students and teachers if they are nearby in closed spaces, meaning a classroom or other areas where it's easily for the virus to circulate. If there is no good ventilation, they can stay for a long time, so they'll be at higher risk of inhaling the virus and getting the infection. You know, we know for a fact one infected person can infect another 4 at least, and it's been shown in different studies. So it's highly infectious, contagious, even in compared to a flu or other viruses.
It's not Friday night yet, but we do have some high school football games tonight, and many teams across the region are forfeiting games due to the virus. And in your opinion, have the school districts done a good job managing the virus, or is it still too dangerous to have kids out on the field?
You know, I wish we can say at the moment it's safe to play football and play sports, but it's not, because even though our numbers went down and became flat, now we're seeing some increase, and we know very well there's continue to see widespread infection between the community members and the kids, children, specifically it's been shown in the study, age about 10 to 18, as high risk of infection spreading as adults. So it is risky because you don't really see in these games people wearing masks or abiding by physical distancing. So it is dangerous to continue doing that.
Dr. Hassoun, there was a period of time where there was some uncertainty about how specifically the coronavirus impacted youth and children. What do we know now that we didn't know before?
So at the moment when we have more information, it seems children younger than 8-year-old or 10-year-old have less chances of transmission and less severe or milder kind of infection. The older or more than 10-year-old, there's actually the risk is the same and can have widespread infection and transmission. The main issue with all this, we really don't want even one kids get in the hospital or die from it. So I don't know if we accept, even though if they have a milder disease, we accept it's okay, because we seeing kids really stay in the ICU for a long time, even though they are much lower in compared to adult, but we shouldn't accept that.
We have a lot more to discuss with Dr. Hassoun, including the timeline for a coronavirus vaccine.
Stay with us. We'll be right back.